setting is also important. Fractured right forearm. Had several bruises on his body but showed no sign of pain while palpating them. He seemed scared and did not answer any questions asked. Which of the following action should the nurse do to gain the child's trust? To gain the child's trust, what action is really indicating? Or what is this indicating? What is the situation indicating?
Child abuse.
It's a child abuse. Why?
Child abuse.
Because
എന്തുകൊണ്ടാ?
not answering any questions.
on the
Yeah.
Who is
He seems scared.
Okay. One is he seems scared, and second he did not
Several
answer any
bruises.
question asked, and third is several bruises. അപ്പൊ ബോഡിയിൽ several bruises ഉണ്ട്. ആ several bruises no pain while palpating. So we don't know like why the bruises happened or how it has happened. So bruises under child is not answering question and child seemed scared. ഇത്രയും കാര്യങ്ങൾ വരുമ്പോൾ തന്നെ അത് abuse ആണ്. But the question is not related with abuse. What is the question asked? Which of the following action should the nurse to do to gain the child's trust? കുട്ടിയുടെ trust എങ്ങനെ എടുക്കാം?
See, showing the play area.
Okay. Everyone is supporting with that. See.
comfort measures.
Comfort measures.
What are the comfort measures for this child? 5-year-old. You have to just imagine 5-year-old child and then select the answer. 5 വയസ്സുള്ള
Fracture ഇല്ല. അപ്പൊ നമ്മളത് ഫസ്റ്റ് ഒന്ന് ഇമ്മൊബിലൈസ് ഒക്കെ ചെയ്തിട്ട്
Asking not
അങ്ങനെയല്ലടാ.
sir.
No.
They're asking
Gain
about
the
gain
child trust in
child
them.
Yeah. Only remember the child and the child's trust. You wanted to just gain the child's trust. നമ്മൾ ഈ കുഞ്ഞു പിള്ളേരെ ഇപ്പം സ്വന്തം അമ്മയുടെ കയ്യിൽ നിന്ന് when you wanted to take the baby from us like a biological parent, you always please come with me, I'll buy a chocolate, or please come with me, I'll take you into in the
Playing area or
park. അങ്ങനെയൊക്കെ പറയുമ്പോഴല്ലേ അവർ വരുള്ളൂ.
yes.
Yeah, so to gain the child's trust, otherwise sometimes we can say like that if this is a boy baby, okay, we'll take you to a ride, we'll drive a car, so they will be really happy. അങ്ങനെ അവരുടെ ട്രസ്റ്റ് എടുക്കാനായിട്ട് സാധിക്കുള്ളൂ. They don't want to eat anything, so arranging meal is really may not gain the child's trust, because at this particular age they don't want to eat anything. And comfort measures is okay, but based on improving the child's trust, I feel like showing play area is better. Okay, and therapeutic communication is not applicable for children. So the correct answer is C.
Option.
ഇവിടെ
Show the playing area.
എന്താണ്?
ആക്ഷൻസിനല്ലേ പറഞ്ഞേക്കുന്നത്. ഫോളോയിങ്
എന്താണ്?
ആക്ഷൻസ്
ആ,
ഇതിലിപ്പോ നമുക്ക് രണ്ടോ മൂന്നോ സെലക്ട് ചെയ്യാനുള്ള ഇതില്ലേ?
ഇല്ല, അത് select all that apply.
സെലക്ട് ഓൾ ദാറ്റ് അപ്ലൈ ഇല്ലാത്തതുകൊണ്ട് നമുക്ക് 2 or 3 ഇല്ല. ഇങ്ങനെ ഗ്രാമാറ്റിക്കൽ കറക്ഷൻസ് നോക്കരുത്. 2 or 3 ആൻസേഴ്സ് ഉണ്ടെങ്കിൽ അവര് പറയും സെലക്ട് ഓൾ ദാറ്റ് അപ്ലൈ പറയും. Next, an 8-year-old child is crying and sad because of death of his parent. What should the nurse do? I'm sorry, this is sad. Not sad, it's sad. Child is crying and sad because of death of his parent. What should the nurse
Allow him to
do?
cry and feelings.
Allow him to cry.
Option C, ma'am.
Okay. If anyone is confused with any other option,
No.
we should not stop crying. Let them accept this
Ignore
current
also.
situation. Yeah. Ignoring is also wrong. Keep him in a quiet environment. That definitely will work. Keep him in a quiet environment will work. But sometimes they will just feel lonely. Sometimes it's based on child's thought. Sometimes they feel like loneliness, otherwise they will be comfortable. But I feel like for this 8-year-old child, they won't be comfortable with a quiet environment. If they are around someone, so they will have like a feeling of togetherness. Okay, but adult, when we consider as an adult, they just sit in a calm environment where there is no any distractions, then they will be really comfortable. But for this particular age, it is not okay. So allow him to cry and accept his feeling. Next. 1-year-old child who goes to daycare is recovering from an episode of otitis media. What is this?
Ear infection.
Middle ear.
Which ear infection?
Inner ear.
Middle ear.
Inner ear or middle ear?
Middle
Middle
ear.
ear.
Middle ear. Okay, it's middle ear infection. And patient is recovering from that. And 1-year-old child. What can be the reason for this particular child to get otitis media?
Water, like preventing.
What can be the reason for getting
Respiratory infections like
it can be respiratory infection. Sometimes it can be an aspiration.
Aspiration.
Fine. Which intervention is most important for the nurse to recommend to the parent in order to prevent reoccurrence? That means it should not happen again. Fine. The otitis media, the child should not get otitis media again. So what action you have to recommend to the parents? Exclusive breastfeeding. That is really okay, but we'll see, we'll read. Not spending the child to daycare. Sending to daycare is not considered as the cause, right?
Yeah.
Preventing water from entering the ear.
Yes. By
is okay.
bathing,
Yes, yes.
it
And
is
smoking cessation by the
by the
parent.
parents.
It's like avoiding passive smoking.
I think the better answer is
Which one is
option
really
3.
helpful?
Ma'am.
Yes.
Preventing water from entering the ear, ma'am.
Third one. Everyone. Third one answer.
Fourth one.
Yeah, if you just give me the rationale, then I would be okay. Why fourth one?
Smoking cessation by the
Respiratory
parents.
infection കൊണ്ടല്ലേ otitis media വരുന്നത് അപ്പൊ വീണ്ടും സ്മോക്കിംഗ് ഇതല്ലായിരുന്നു.
Oh, it's like a respiratory part.
I don't know, ma'am. the
Smoking
option, but
cessation
I am okay with the option 3.
by the parent. Okay. Over is like, okay. So third one says like a preventing water from entering the ear. That means that can further increase the chances of infection. Smoking cessation by the parent. That means the parent should stop smoke, because the passive smoking can be protected or prevented. It can always help the baby to get free from respiratory infection. Okay. So which one? You can just drop your answers. So the highest answers, let me see. How many of you want fourth option? Okay, third one. Okay, highest. Okay. Third one on a better one. Even fourth is also really okay. Both answer. Fourth one is also okay. But preventing water from entering the ear, that's the first priority. In order to prevent a reoccurrence, you can give priority to 3. Next. 3 days old newborn is diagnosed with Hirschsprung's disease. Again, this is 3-year-old with Hirschsprung's disease. The nurse is conducting physical examination Which of the following finding will alert the nurse to suspect the disease in newborn? So one of the sign when you find out during assessment that is suspecting the disease with the newborn. So very simple question. What is the sign of Hirschsprung's disease?
Pass of meconium.
Failure to pass meconium.
Failure to pass meconium within 24 to 48 hours. Okay, fine. So what is first option says? Palpable sausage shaped mass. What is that indicating?
Interception.
Intussusception. Yeah. So first option is indicating intussusception. What is second option indicate? Cyanosis of finger and toes. It is called as acrocyanosis. Acrocyanosis എന്ന് പറഞ്ഞാൽ നമ്മുടെ കയ്യിലും ഫിംഗേഴ്സിലും അല്ലെങ്കിൽ കയ്യിലും കാലിലും പാദത്തിലും സോളിലും ഒക്കെ ഉണ്ടാവുന്ന സൈനോസിസ്. അപ്പൊ അത് acrocyanosis it is called as, and that is indicating hypoxia, that is sometimes indicating cold exposure, but usually for the first 1 or 2 days acrocyanosis is okay. It is considered an okay thing, normal one. Failure to pass meconium is the sign of Hirschsprung's disease. First sign, palpable sausage shaped mass, is indicating intussusception. I want everyone to write down, because if you know, then you can just leave it. Otherwise, if you don't know, you please write down and learn. Fourth one, weight less than expected for height and age. Basically, for up to first 1 week, that there will be weight reduction or weight loss is expected. So it's quite normal thing. So answer is third one.